Thank you, Mr. Chairman, and thank you, panelists. Mr. Chairman, this is an important hearing, and I'm glad you held it, but it is not the most important hearing that we should be having. It seems to me that the most important question that we should be asking ourselves is, number one, why is the United States, the richest country in the history of the world, the only major country not to guarantee health care to all people? Simple question. Number two, not unrelated, why is it that in the United States, despite the fact that we have 85 million people uninsured or underinsured, that some 60,000 people a year die unnecessarily because they don't get to a doctor when they should because they're uninsured or underinsured, when we don't have enough doctors or nurses or dentists or mental health counselors, when our life expectancy in the richest country in the history of the world is 4 years lower than OECD countries, and if you're working class, is significantly lower than that, why is it that 500,000 people in America go bankrupt because of medically related illnesses? Those are simple questions, Mr. Chairman, and maybe it's time we start asking. So in all due respect, I would hope, Mr. Chairman, that the next hearing we have on this issue is we bring people from other countries who are providing health care to all of their people as a human right at a fraction of the cost that we spend. So maybe we have somebody from Australia here, which has health care for every man, woman, and child. They're spending about half as much. We're spending close to $15,000 per person. Our problem is not that we're not spending enough money, we're spending a fortune. The question is, where is that money going? Who benefits? Maybe we ask somebody from France to come here to explain to us how they guarantee health care to all people as a human right, spending less than half of we spend. Canada, UK, Japan. Japan spends less than $6,000. We spend close to $15,000. Somehow they manage to provide health care to all people. Now, one of the reasons clearly that health care in America is so very expensive is that we have an unbelievably complicated system in which we spend a fortune on administrative costs. I would hope that most of us agree that when we spend $1 on health care, we want to go to a doctor, to a nurse, to prescription drugs, not to some bureaucrat who is telling a doctor what he or she cannot do. So let me start off with my questions, and just a very simple one, go right down the line. And please be brief, I've got all of 2 minutes. Should the United States join every other major country in guaranteeing health care as a human right, which says that if you're rich, you're poor, you're working class, you're going to get all the health care you need to live a decent life? Sir, is health care a human right? Yes or no?
Yes.
It's a human right. You think that everybody in America, regardless of income or age, should have the comprehensive coverage that they need. Is that what you're saying?
We'd have to agree on what comprehensive means, sir.
Well, comprehensive is not a difficult word. It means that if a working class person, an unemployed person comes down with cancer, they get all the treatment that they need, does not die unnecessarily. In other words, are all lives created equal? Or if you're rich in America, you get very good health care. If you're working class, sorry, you may have to die.
Acute and emergency care? Certainly.
Pardon me?
For acute and emergency care, certainly. For elective care, I'm not sure we'd agree.
I beg your pardon. You're talking to the mic. I missed your point.
I said if it's acute or emergency care, absolutely. If it's an elective procedure, I'm not sure we'll agree.
So you think everybody for comprehensive covers all basic health care needs? Is that what you're saying or not?
Basic?
Well, basic means that if somebody comes down with cancer.
These words are subjective, sir.
Well, they're not subjective. 60,000 people die every year in this country because they don't get the health care that they need. Sir, is health care a human right?
I think our country should provide universal, comprehensive, affordable health coverage to everyone.
Health care a human right?
I strongly believe that all Americans should have access to affordable, high-quality health care.
Access, but what happens if if I'm making $35,000 a year, $40,000 a year, and I come down with cancer?
I mean, Senator, I think we should have a strong safety net to protect the most vulnerable Americans.
What is the most vulnerable Americans?
Well,
We have 60% of our people living paycheck to paycheck. Are they vulnerable? Should
yeah,
all of them be guaranteed?
They should have access to high
Are
quality.
you using the
affordable
word
healthcare.
access? I have access to $1 billion home. Doesn't mean I can buy it, right? I have access to a fancy car. Do they get the
Senator,
care as a right?
I think that the way that we improve healthcare is to reduce government's interference in the health
Really?
sector.
But every other country that is providing comprehensive health care to all of their people is doing it through significant government presence.
I mean, I think there are some excellent features of the American healthcare system. People come here from other countries to access
Yeah, well,
much
people
of our
go out of this
medicine.
country. Okay, Mr. Armitage?
I absolutely agree. I think in the meantime, we need to extend the subsidies so that we can get
I
to
agree
that
with
point.
Absolutely. Okay, thank you, Mr. Chairman.
Thank you.